Mexico. I'm Dr. Tracy Collins, newly appointed Cabinet Secretary for the Department of Health. I'm here with good news. The very first doses of the Pfizer vaccine have arrived in New Mexico, with more arriving today and tomorrow. All told, we expect to receive 17,550 doses of this first shipment of vaccine, with plans already in motion to distribute doses to more than 30 hospitals throughout the state. Today, we begin to turn the tide, protecting ourselves and our communities and moving past this terrible virus toward a brighter day. If I may, let me step back and review what has occurred in the past few days, how we got here, and what it means for our state. On Friday, after thoroughly reviewing the safety and efficacy of the Pfizer-BioNTech vaccine, the Federal Food and Drug Administration granted an emergency use authorization, or EUA. On Saturday, an advisory committee to the Centers for Disease Control concurred. New Mexico's medical advisory team has also reviewed the vaccine development research and agreed with the FDA and CDC assessments. The Pfizer vaccine is being distributed directly to pre-identified locations throughout New Mexico, and the first shots began yesterday. The initial shipment of 17,550 doses is being prioritized for frontline healthcare workers in hospital settings, starting with staff that are high or medium risk of exposure to the virus. As New Mexico receives additional shipments in the coming weeks, we will continue to provide vaccine to frontline healthcare workers, as well as staff and residents of nursing homes and other long-term care facilities. The principle here is simple. The first vaccine doses will go to those who are most at risk of exposure to infected people or infectious materials. Here's what else you should know about the vaccine. Like nearly all COVID vaccines currently in development, the Pfizer vaccine requires 2 shots, a first dose and then a second dose 21 days later. While the vaccine prevents COVID infection, we're still learning whether it prevents transmission. This means that as New Mexicans begin to get vaccinated, we still need to wear masks, maintain 6-foot social distancing, wash our hands often, and keep up with other COVID-safe practices. This is a very important point and bears repeating. Even after getting vaccinated, we need everyone to continue to wear masks and follow COVID-safe practices. In the coming weeks and months, we expect additional vaccines to receive approval and additional shipments to arrive, and we will continue to provide regular updates. For now, though, I hope we can all savor this most promising and uplifting moment. For the past 9 months, the coronavirus has wreaked havoc across our state, around the country, and throughout the world. As I said at the outset today, we begin to turn the tide, protecting ourselves and our communities and moving toward a brighter day. This will take many months and much patience, but we will get there. Thank you, New Mexico, and I welcome questions from members of the media participating in today's call.
Thank you, Dr. Collins. A reminder to our media folks to raise your hand in the chat to let me know that you have a question, and we will go ahead and get started. We'll start with I believe SFR is Santa Fe reporter, but does not say who the journalist on is. So if you can please identify yourself.
Sorry, Nora, it's me, Julia Goldberg. Thank you, Dr.
Julia, go right ahead.
Thank you, Dr. Collins. 2 quick questions. Other states have let folks know what they expect overall for the year or the next 6 months, in terms of what it will be receiving dosage-wise. Does New Mexico have any other information aside from the initial 17,550 Pfizer doses? And my second question is, I'm wondering, there's been some national polling indicating about a 60% willingness among the public to be vaccinated. Is there any data or other expectations on the part of the state in terms of what you think we'll see here? Thanks so much for this opportunity.
Sure. And regarding the doses, what we know for sure is that we're getting the 17,550 doses. And once we have more information, we'll share specifics on numbers and give total, but we have confirmed that amount that we'll receive. And so regarding your second question, you know, the 60% uptake or people, their willingness to take the vaccine, we're going to learn more as we roll this out. And we'll be happy to share what we learn. What we're working on is our messaging. And for now, the first group will be the healthcare workers. And we're hoping that we'll have more than 60% uptake from healthcare workers, but we will learn moving forward.
Thank you, Dr. Collins. Next, we'll go to Steve Solis with KOB.
Hey,
Steve, go right ahead.
sorry, Doctor, thanks for taking the time to talk with us today. You got me, I'm sorry. I'm an idiot when it comes to this stuff. Doctor, I want to ask you a question regarding just communication between the state and the feds, just kind of how you're taking how that's been. And then my second question I want to ask you is, as you step into this role, what you believe are challenges maybe as a state, whether it's participation in the mandates that have been placed in front of us or just our ruralness as a state. Just want to get your thoughts on that.
Yeah, could you repeat your first question?
Sure. The communication between the state and the feds, how that's been, and just your confidence in that relationship moving forward.
Yeah, so I think our communication with the feds has been very positive. We have been able to work with them. We've got a leader within the Department of Health, Dr. Sanzoni, who has been able to communicate with the CDC and make sure that we're on top of our doses that we're receiving, and that communication has been pretty seamless. And to your second question, it was in regards to, could you clarify?
Just your belief of what our challenges may be as a state as we try to conquer this virus.
Well, the challenge for any state at this point is to make sure as many people are vaccinated as possible. And so we are reaching out to rural and urban areas equally, but having people understand that the value of this, and also that getting this vaccine really protects you from disease. You still need to wear a mask, you still need to wash your hands, you still need to distance, and making sure that people are clear on that. Those are the things I see as some major challenges up front.
Thank you, Dr. Collins. Next, we will go to Dan McKay with the Albuquerque Journal. Just a quick note, I have someone on here who is identified as Robert. If you could please send me a message giving me more information on who you are. Thank you. We'll go to Dan with the Albuquerque Journal.
Hi, Madam Secretary. Thank you for taking our questions. I have two questions. The first is the initial batch of 17,000 doses. Is that enough to, are you vaccinating one person with each of those doses, or are you holding back half of them essentially to give a second dose? And then the third question, or excuse me, the other question is, do you have any sense of when, say, an older adult who's 70 and has been staying home as much as possible, when might be the timeline for that group of folks to get their first dose? They're not a long-term care resident, but just someone who's been at home and is older and is being particularly careful. And I'll mute myself. Thank you.
Sure. So as far as the initial batch, we really see that as the first dose for each person. The next round of doses that they would receive within 21 days or at 21 days. And so it's going to be one dose per person for this first batch, this first tranche. As far as the older adult who's staying at home, we will have more information as we learn more about the doses available to provide information on the next phases. So the next group, as you probably know, would be long-term care facilities. But as soon as we know more about the doses we're going to receive, plans are underway to identify the order of how we distribute those vaccines.
Thank you, Dr. Collins. Next, we will go to Susan Montoya Bryan with the AP.
Good morning, Dr. Collins, and thanks for taking our questions. My particular question revolves around tribes and our coordination with between the state and the tribes. Can you talk a little bit about how that whole process is working and any challenges that you see there in ensuring that they get the vaccines that they have requested and need?
Yeah, New Mexico's tribes have really suffered greatly during this pandemic, and they are a priority. Most have chosen to receive their vaccines through the Indian Health Service, but 3 have chosen to receive their allocations from the state. And those 3 are Acoma Pueblo, Laguna Pueblo, and Picaris Pueblo. And so we will have doses going to those 3 pueblos as part of this rollout.
Thank you, Dr. Collins. Next, we'll go to Robert Knott with the Santa Fe New Mexican. Robert, go right ahead.
Thank you, Nora, and thank you, Doctor. I have 3 questions, so I'll ask them one at a time if that's okay.
Sure.
Following up on Dan's question, 1 dose per person, I'm still not clear. Does 17,550 cover 17,550 doses, or given they need a booster shot, is it really half that amount with the second shot coming in? So that's question 1.
Okay, so they will need a booster. So the first round of the people who receive this first 17,000, they're going to need to get the next dose when we get the next batch. Does that answer your question?
Yes, thank you. So they'll be waiting on a booster from another dose. Okay.
Yes.
And then I'm curious, is the Department of Health, are individual hospitals or agencies giving out the doses, are they responsible for keeping an eye on people for after effects, symptoms, things that we're still trying to figure out as we roll the vaccine out?
Yeah, so those initial batch will go to over 30 hospitals, and each hospital will be responsible for distributing it and making sure people are safe. So watching them, observing them for at least 15 minutes after they receive the vaccine.
Thank you. And then the third and last question is, where do we stand with crisis standards of care in the Department of Health and or the governor probably enacting them before the end of the calendar year? I see our numbers are flattening a little, but I know you all are cautious. So are we still looking at the likelihood of that becoming reality, say, by the end of the calendar year?
It's a good question. We're still watching the numbers. Right now, we're in contingency mode. We're certainly preparing ourselves for crisis. I'm hoping we don't reach that, but we have to watch the numbers and see the after effects of Thanksgiving and then approaching Christmas, what that impact is.
Thank you.
Thank you, Dr. Collins. Next, we'll go to Gabrielle Burkhart with KRQE. Go right ahead.
Hi, thank you for taking our questions and hosting this. I also have 2 questions. The first one, similar to our case updates each day, will the state be providing numbers of how many people are vaccinated each day? It seems like a key metric we need to, I guess, start tracking in some way, considering we've talked about, X percentage of the population needs to get vaccinated. So that's my first question. My second one, is similar. So we don't know necessarily how many people. A few hospital administrators yesterday said they will not make this mandatory for their staff, although we understand that some hospitals do require the flu shot. So I guess I was just wondering, what is the thinking? Is this vaccine, being considered a little different than the flu shot because it is so new? Or, why not mandate this for healthcare workers? Thank you.
Right. So the metric info will be very useful. And as we move forward and we have our data together, we can provide that information to the public. I do agree with you. That'll be important. And as far as mandating this, given that it's emergency use authorization, we are making sure that we give people a chance to say yes or no. We're hoping that more people will take this. I personally am getting in line to take mine. But the hospitals are correct in that they can't mandate that someone take this vaccine.
Got it. Thank you. So just to your first answer, this metric info will be important. Will it be sort of included in the daily updates eventually?
That will be the goal, yes.
Thank you.
Thank you.
Thank you, Dr. Collins. Next, we'll go to Nancy Laughlin with KOAT.
Hi there. Hi, Dr. Collins. I have a couple of questions. I know you did address this, but if you can elaborate more on after the medical workers get their shots, how are you going to decide who gets the shots next? If you can elaborate on that. And then my other question is, and it's not about the vaccine, but we've been getting contacted by a lot of viewers who are having to wait in line to go into the grocery store. Many of them are elderly who have respiratory problems. Are you concerned about any sort of respiratory infections? Or what can you tell those folks who are having to wait, people who are elderly and disabled, wait to get into the stores?
Yeah, to your last question there, that is a concern with the cold weather. And, you know, obviously we need to identify solutions where maybe we can have groceries delivered during this deep freeze that we're in currently, which won't last forever. But we need to provide some other options for the elderly and those who are at risk, because that really is concerning, particularly as we move towards winter. Regarding how we prioritize who receives it, at this time, what we have outlined is the healthcare workers and then long-term care facilities. And we're now in planning phases about how we decide the next groups to receive the vaccine and in what order. The tiers is what we call them.
Thank you, Dr. Collins. Next, we will go to Marissa Syons with KFOX out of El Paso, Las Cruces. Marissa, go right ahead.
Hi, Larry. Thanks so much for taking questions. A quick question that kind of elaborates a little bit more on just the question that was just asked. Here in El Paso, there are phases, much like the tiers that you just explained. But one thing that our public health department has talked about is getting with local providers across the city, and different, for us, it's just El Paso, but how are you coordinating with different municipalities across the state to help or be able to get them doses? That way, whenever the general public is able to get doses, they're able to administer them.
Yes, we have a COVID vaccine distribution team, and we have working with the CDC, and we've had groups around the state register for what they need. And so we've coordinated with those various groups and the public health officers to reach the entire state as far as making sure we get doses out based on the needs that were presented when they registered.
Thank you, Dr. Collins. Next, we'll go to Matt Reichbach with the New Mexico Political Report. Matt, go right ahead.
Hi, thanks for doing this. I just wanted to have a question about the Moderna vaccine, which appears to be getting close to emergency use approval authorization from the FDA. How will that impact the state's efforts on vaccinations, and particularly how will you track who has gotten which vaccination and who needs to get which booster shot? Thanks.
Yeah, so the idea is that Moderna, if it's approved, that would go to the long-term care facilities. We're still working on the plans for that once we confirm that it will be distributed, and we can provide more information moving forward.
Thank you, Dr. Collins. We have a follow-up question from Robert Knott with the Santa Fe New Mexican.
Thank you, Doctor. Almost perfect following on the new one. And you've touched on this, but a little more clarity on, let's just say 2, 3, 4 vaccines are found overlapping. Does the state simply follow FDA guidelines? If the FDA says they're all good, how do you pick which one, or do you grab whatever you can based on what's coming out and assuming it's approved? Thank you.
Yeah, so certainly I appreciate the questions. We certainly want to run that through the various channels that we've run for Pfizer. So our medical advisory team needs to weigh in. And then it's a matter of looking at access to the various vaccines, efficacy, safety, and just ensuring we're doing the best for New Mexico to get as many people vaccinated as possible.
Thank you, Dr. Collins. And another follow-up from Gabrielle Burkhart with CARE QE.
Hi, thanks. One quick question, since I know that, this is a very hopeful time for a lot of people, but obviously it's been mentioned and repeated that testing for COVID will still be very important in the coming months. And I know the FDA recently made an approval for an at-home test. Is this something that New Mexico will start doing? Is this in the pipeline to, do more sort of those rapid or even just at-home sort of convenience tests for COVID?
Absolutely. Plans are underway and moving forward to use Vault to actually have the at-home test available to New Mexico residents. So we are now in the planning phase of that and moving forward for sure. Testing will continue to be important, and I appreciate the question and reminder. So we are balancing, making sure we continue with testing, looking at options that are efficient like the at-home test, but also then revving up for vaccinations.
Gotcha. But you don't have any timeline for when that might be made available to New Mexico?
Not just yet, but it's going to be soon.
Okay, thank you.
And next we have a question from Matt Grubbs with New Mexico PBS.
Thanks, Nora. Thanks, Dr. Collins. I'm wondering, I'm certain that there's no data on this with the current vaccines, but in your experience, can you talk a little bit about how people's behavior changes when there's a vaccine available? Maybe going back to something like H1N1, something like that.
So in regards to how their behaviors change when they have the vaccine, there certainly is this idea that I'm now safe. I don't have to worry about, contracting this infection. With influenza, there is the idea that you protect yourself and then you can spend time in the winter not having to worry about contracting this or recognizing you have a reduced risk. With COVID, the difference here is that, we're learning more about this virus. And even with this vaccine, you're reducing your risk for disease, but we still have to wait for more data on how you reduce your infectivity. So the difference with this is that we still have to maintain those COVID safe practices. And so you can't let your guard down. You need to wear the mask even once you have both the doses, both the vaccines, the dose 1 and then the follow-up. And you need to wash your hands and maintain distance until we have more information. So this particular virus is a little different.
Thank you, Dr. Collins. I will turn it over to you to make any wrap-up statements if you so choose.
Okay, and I'm happy to take a couple of more questions if there are questions out there.
Anyone else have any follow-ups? Okay, Robert Knott with the New Mexican.
Thank you again, Doctor. I appreciate that. I've asked this question of healthcare professionals, but where do you see us in a year in terms of this vaccine in this state? Will we be out of the woods? Will we be 70% vaccinated but still have to wear masks? What's your thoughts on that in terms of our mental, physical, and emotional health?
Yeah, we're all exhausted. So what I'm hopeful for is in 1 year that we will have more than 70% of our state vaccinated, that we will have really a good response to the vaccine, that we will begin to have more data on whether or not you have can reduce your transmission of the virus. And so we will have more data on whether or not you can stop with the mask, the social distancing in a year, that we'll have the data that will inform what we do moving forward.